today we're talking about cognitive adaptation training, and it's also known as CAT, not dogs, just CAT. So CAT is a compensatory approach that uses environmental supports to bypass cognitive impairments or negative symptoms of psychosis. And that helps a client to perform activities of daily living as well as improving community functioning. So there's been a lot of research into CAT, and it's been shown to have significant benefits for individuals who live with psychosis or schizophrenia. It improves their treatment adherence as well as functional outcomes. Specifically, they have greater adaptive functioning and higher quality of life. So how the CAT intervention works is it begins with some assessments. There's functional assessments and neuropsychological assessments, and those help you learn more about the specific cognitive challenges that the client's having. And in CAT, there's two main constructs that are considered, and they help determine what types of strategies to use with each client. So the first kind of construct you're looking at is apathy and disinhibition, or some people may have both. So apathy would be having difficulty getting started with tasks. And disinhibition is when someone has trouble staying organized and carrying out the task. And if someone has challenges with both apathy and disinhibition, you'd use a combination of prompting of steps and removing distracting stimuli. The second construct that's considered is executive functioning. So the level of executive functioning helps determine the level of cues that are. So in addition to those cognitive assessments and doing some functional assessment, we'll also assess the client's home or another community environment like their workplace. So after you've done all those assessments, you consider the factors that you've assessed and talk to the client and their family members. And together with them, you identify functional areas to address. And then you can start using those individualized environmental cues and supports to bypass the cognitive challenges and to increase function. So right now, we're going to see an occupational therapist implementing some environmental cues to support a client who has psychosis. And you've done some assessments and found out that he has both apathy and disinhibition. So we're going to use some strategies that address both of those things.
Hi, so we're here today to talk about how my son Chris is doing and some concerns that I've been having with him going to work and just daily living. So one of the biggest concerns I have right now is that Chris is forgetting to do his laundry, and he's re-wearing the same clothes over and over again. And that when he does that, it causes there to be a lot of stains on his clothes that he's just not aware of. And then if he does do laundry, a lot of the time he forgets to use laundry soap, so those stains don't even come out.
Chris, does doing your laundry sound like something you want to start working towards?
Yeah, it's definitely on my goal list of things to do. Yeah.
Okay, great. So there's a couple of strategies that we can talk about to make laundry a bit easier for you. So one thing that we can do to help you recognize when you have stains is to use a sign and put it somewhere you'll see right before going out to work. And it'll just remind you to check your clothes and see if they have any stains. So I know we've made up that sign. Is there somewhere that we can put that you would see it every day before you go to work?
Yeah, I can show you some options. So here's the sign that you made me. I'm thinking of putting it like maybe here.
Almost thinking that might work a little bit better is you often go to the mirror by the front door before you walk out, because the closet doors are usually closed in front of our washing machine. What do you think about that?
Yeah, let's take a look. So you mean like here?
Yeah. Okay. Normally you look in the mirror before you walk out the door, so I think that might be a better spot.
Right.
It looks like a really good spot. Perfect. And looks like a good height. You won't miss it. It's right at eye level. So a second thing that you mentioned was challenging is just having clean clothes that are ready to wear. So one thing that we can try to help you with that would be, I know you use your Google Calendar for your work schedule, and sometimes your mom helps you putting your hours in. You could put in a time to do laundry, so schedule it right into your Google Calendar. And then you'd have an alarm too that alerts you when it's time to do laundry. And that will help you remember to do it. Does that sound like something that would work for you?
Yeah, I can do that.
Yeah, perfect. Thank you. I think
and then the third thing you mentioned was sometimes when you are doing the laundry, Chris, you forget to put the soap in with the washing, and that happens. It's hard to remember. There's a lot of parts to doing laundry. So something that we have to help you, stay on track and just work through all the steps of the laundry without forgetting anything is to use a checklist. So I know we made a checklist up that includes the steps you use when you're doing laundry. So you can use that as you're doing laundry and check them off as you go along. Maybe there's a spot by the washing machine that you could hang that up. Do you think there's a place for it?
Let me take a look. I'll show you the list I think that you gave me. So this one.
Yeah, perfect.
I'm thinking of maybe putting it here so I can see it when I'm doing the laundry.
Sometimes after we've had the same sign or the same list for a while, we kind of stop noticing that it's there. So if that does happen, something that your mom can do is print it out with another color paper or maybe bigger even. And that just helps you remember that it's there. It makes it look a bit different.
Well, that's a great idea. I definitely will keep that in mind. Thanks.
Perfect. All right. Nice. I like the magnet to hold it up. And then one other thing that we can do to help you with the soap and getting all the different steps of laundry done is instead of using the jug of laundry detergent and measuring it out and then putting it into the washing machine, you can actually just try those single packet like a Tide Pod, and then it's just less steps for that whole process. And that.
So like this one?
Yeah, just like that. That's perfect. I'll start out with using those 4 strategies for the laundry: the sign by the door, the Google Calendar with alerts, and the checklist, and the Tide Pods. Perfect. Okay, well, I will give you some time to try that out until next week, and then we'll talk about how it works. After the OT intervention with the client and his mom, there was continued support from peer support family, and that is someone who has lived experience. So this was another mom who has a son also with psychosis, and they've been using CAT for years now, and they found it really helpful.
Hello, Mama C. How are you?
Good. How are you today?
I'm good. I'm just Rihanna, your friendly peer support worker. Oh, and there's Chris. Hello, Chris. How are you?
I'm good, thank you.
Oh, it's great to see you both. So, Chris, I hear that you were working with the occupational therapist on doing laundry. How's that going for you?
It's been great. I've been going to work with clean clothes, so it's been better that way. And I've been getting into a routine of going through the checklist that you gave me and using some of the signs that I received from you.
Wow, well, that sounds like it's going really well. Congratulations. And good for you for using the strategies that you worked together to figure out.
Yeah, there is one thing though. Chris has been doing a really good job with doing his laundry, but then he did buy a brand new red sweater and washed it with all of his whites and dyed all of his clothing pink. And he just continues to put everything in one load without separating it out, which is problematic at this point.
Sure. Yeah. Well, you know what? My son Johnny, when he did something similar actually, except with something that we did that we found really helpful for us was we got 2 laundry baskets, and in those baskets we put 2 signs. So just like a white clothes sign and a colored clothes sign. And yeah, then Johnny knew to only put colored clothes in the colored basket and white clothes in the white basket, and wash them separate. So do you think that might be something that can help you, Chris?
Yeah, I think that might work.
Well, I can send Mama C copies of the signs we made, and maybe she could print them off, and you folks could put them in your laundry basket.
Yeah, we'll definitely give that a try. I think that would be a good starting point.
I'm also noticing, Chris, that the clothes you're wearing right now don't have any stains on them.
I don't have any stains anymore, so I'm less embarrassed when I go out and stuff.
That sounds like you're feeling better about how you look and you're feeling less embarrassed. So that's really awesome. Way to go. I know you guys have put in a lot of hard work to make this happen. And yeah, I think that's really awesome to see how you're achieving this goal.
So what you've just seen is an occupational therapist doing a CAT intervention with a client. And there were a couple of different cues and strategies that the 3 of them came up with together. There are some signs that the peer support worker suggested during the follow-up for white clothes and colored clothes in the laundry baskets, a checklist to be used while doing laundry. And there's a sign at the mirror by the door where Chris leaves for work to remind him to check if his clothes are clean and free of any stain. So this video has been an example of how you might use a CAT intervention with your clients in the future.